Hello, everyone. My name is Jim Jenkins, and I'll be presenting the fifth and final session of our Triad conference presented by Triad of Wisconsin and RSVP of Dane County. Before I introduce our presenters, let me say that during the presentation, if you have a question, please type it in the chat panel to the right of your screen. I'll be keeping an eye on those and bring them to the speaker's attention. It'll be helpful if you can direct the question to a specific person on our panel. Second, if anyone or everyone who has requested continuing education hours will receive them based on attendance records kept by the GoToWebinar software. It's no longer necessary to complete the survey to receive the CEHs. Third, we'll be emailing everyone a survey at some point after we conclude today, and hope that everyone will take a couple of minutes to give us your opinions and recommendations about these sessions. This session is going to be a panel of 3 speakers who will discuss current issues related to the COVID-19 pandemic. So I'd like to welcome Sri Mohan, Jennifer Fischer, and Diageos, and thank them for taking the time to address these important topics. Sri Mohan is an epidemiologist with Public Health Madison, Dane County, and we're really lucky to have her with us today. She specializes in health among our aging residents. Her topics covered will include general information on COVID-19 related to older adults, data, misinformation and disinformation, how to minimize your risk of infection, strategies for safe interactions, and resources to stay engaged, resilient, and healthy during the pandemic. Jennifer Fischer is our second speaker. She's manager of the Aging and Disability Resource Center of Dane County and has held that position since the ADRC opened in 2012. Prior to that, she worked she's worked for Dane County since 1999, holding positions in Child Protective Services, long-term support, and is the supervisor of the long-term support unit. She has a master's degree in social work from the University of Wisconsin and obtained her bachelor's degree from Carroll University in Waukesha. Jennifer will talk about COVID-19 and being a caregiver during the pandemic, and about resources to help a caregiver take care of themselves during this stressful time. And our final speaker, Diageos, is a certified financial planner and director of portfolio and wealth management for RMR Wealth Advisors, LLC. And Doug is going to discuss the financial impacts and opportunities for older adults as a result of the COVID-19 crisis. So thank you, and let's get started with Sri Mohan.
Thanks, Jim. Can you hear me okay?
Yep.
So hi, everyone. Glad to be here this morning, and thank you all for joining the session. And thanks, Nate, for the wonderful presentation. I think safety and security is more important now than ever. So today, I'm just going to give you a brief overview about COVID as it relates to older adults, some data like Wisconsin-related data, and then tips to stay safe and healthy during this pandemic. As you all know by now, the virus that causes COVID is spreading very easily and sustainably between people. The most common method of transmission is through close contact, especially through respiratory droplets, and sometimes it can also be spread by aerosolized droplets as well. Older adults and then and others who have an underlying medical condition are at a higher risk of getting infected and develop more severe complications. And presentation of symptoms is often atypical in older adults. And some recent studies have suggested that COVID-19 can be spread by people who are not showing any symptoms. So you can have COVID and not show symptoms, but be shedding the virus. And cases of reinfection with COVID have been reported, but is rare. And the risk of reinfection may be lower in the first 3 months, but we still need to know more about this. And these are some of the symptoms: fever, cough, shortness of breath, sore throat, etc. And then older adults symptoms have started, like it's more for like related to GI symptoms than other symptoms. And in the initial stages, I think it was missed because they were showing GI symptoms and were not tested for COVID, but that's something to keep in mind. And you can also have symptoms for anywhere between 2 to 14 days after you're exposed to COVID. And another thing to remember is older adults, on like average, normal body temperature is really like lower than in younger adults. So fever temperatures can also be lower for older adults. So that's something that you need to bear in mind when you're monitoring for symptoms. So some of you might have decide to test at some point in time or have already tested. So these are some of the tests that are available. The PCR, or the polymerase chain reaction, is the most widespread and most accurate diagnostic test. It detects whether someone has the infection currently, and it looks for viral genetic material. The antibody test, which is also known as the serology test, does not detect the virus itself, but it looks for antibodies to fight the COVID infection. So it identifies people who have been previously infected. So that's not a reliable test to act based on the results that you're seeing. Antigen test is also being used right now. This is much more rapid and a cheap test. It is similar to the pregnancy test. It identifies people who are currently infected with COVID-19. It can be used to screen people and identify very quickly, but a confirmatory test may be required. And this also looks for the viral proteins. So if you do decide to get tested, right, and then if your test is either PCR positive or antigen positive, you need, like, some of the steps that you need to do is like stay home, and then get rest and stay hydrated, stay in touch with your physician, and separate yourself from other folks outside and even within your own family. And if you test negative for COVID, a negative test result does not mean that you will not get sick later, right? Like, so you probably were not infected at the time your sample was taken, or there was not enough viral load at that time to identify a positive result. So you could get infected at some other point in time as well. So contact tracing is how public health departments identifies and isolates or quarantine folks to mitigate the spread of virus. But right now, given the surge in the cases throughout Wisconsin, public health departments are not being able to contact trace in a very timely manner, which is very important. So I just wanted to provide some clarification on isolation and quarantine so you're informed and equipped. What to do, right, when you're exposed or you test positive and your public health department has not contacted you. So isolation is separating sick people with a contagious disease from people who are not sick. And who needs to isolate at this time are folks who have COVID, and that is people who have symptoms of COVID and are able to recover at home, and people who have no symptoms, that is, they are asymptomatic, but then they tested positive for COVID-19 through any test. And then quarantine separates and restricts the movement of people who were exposed to a contagious disease to see if they become symptomatic or if they develop the disease. So anyone who needs to quarantine is anyone who has been a close contact with someone who has had COVID-19. And who counts as a close contact is if you're within 6 feet of someone who has had COVID-19 for a total of about 15 minutes, or you provided care at home to someone who is sick with COVID-19, you had direct physical contact with the person, you shared eating or drinking utensils, or if they sneezed, coughed, or somehow got respiratory droplets on you. So being an epidemiologist, I had to share some data with you all today. So let's just look at what is happening in Wisconsin. If you look at this slide, This shows the activity level in Wisconsin for COVID. So we're at a heightened level of activity here, surge is happening everywhere. If you look at the counties, 68 out of 72 counties in Wisconsin have a very high level of activity, and the other counties are at a high level of activity. And if you want to understand a bit more about the data and how it is measured, the reference link is there. So please click at that on the link, and then you can go through those at your convenience.
Sri, I'm not seeing the slide.
You're not seeing the slide?
No.
I see it.
Jim?
Oh, Mike said he's seeing it, so.
Oh, okay. All right.
My problem. Okay.
All right. Thank you. And if you look at the summary statistics, so close to 2 million people have been tested so far in Wisconsin, and about close to 200,000 have tested positive. So one thing we need to note here is it took about 7 months for us to reach 100,000 positive cases, but it only took a little over a month, approximately 36 days, for us to reach almost 200,000, right? And then our 7-day average is at almost at 4,000 cases a day. So that's something for us to kind of bear in mind as we move through this pandemic. And the next slide shows COVID-19 case counts, deaths, and hospitalization by age group. The top graph shows the cumulative case number by age group, and you can see the younger age group has the higher case counts. But when you look at the bottom two graphs, the percentage of death and percentage of hospitalization is higher in the older age group. So that's something, we all have a responsibility in making sure our older adults are safe. And this slide shows the hospital capabilities in Wisconsin. Our hospital systems right now are pretty overwhelmed. In Wisconsin, 84.5% of hospital beds are in use, and 86.8% of ICU beds are in use, and 19.2% of ventilators are in use right now. And if you go on the reference link, if you want to click to see your HERC region, that is the Healthcare Emergency Readiness Coalition region, so you can click on the link and then click your region from the drop down menu, and you will be able to look at these metrics for that particular region. So and I think you all know the alternate care facility has also been opened in Wisconsin, and I think we are maybe one among the 5 states that is using an alternate care facility because of the surge. So this pandemic is like unlike any other we have seen, right? And that is probably going to stay here for a while. So what can we do? Let's look at some strategies to stay safe, healthy, and also maintain some normalcy. So before we do anything, I think we need to stop the infodemic curve. There's a lot of misinformation that is going on out there, and we've been also exposed to a huge amount of information on a daily basis, right? And then not all of it is reliable, and many folks get their information from a variety of sources, like it could be Facebook or WhatsApp or any other social media platforms. This creates anxiety and fear and can be detrimental in how we respond to the pandemic. So equipping yourself with reliable information is very important, so we don't face this pandemic with fear, but with intelligence. So some of the tips that you could do is, if you do get some information, right, and then if you think it might be a rumor, do not send it via group chat. Double check your facts, and then get your news from trusted sources. And that's been hard during this pandemic, right? And then there's been a lot of miscommunication at even CDC level, but still they are a very reliable source of information. Like the CDC, you can go to your state health department's website or your local health department websites to get the right information. And ask, if you get some information, just ask, how do you know it is true, right? Before you just send it on an email blast or like a chat blast.
Sri, we've got a few questions and we're going to have to wrap up your portion at this point. So let me ask you those questions right now at this point. First of all, what recommendations do you have for family gatherings during the upcoming holidays?
So for family gatherings, I would say, if you do want to gather, you should do so safely, right? Like you have to have a mask, you need to be like socially distanced, even if you are indoor setting. I would say that, you have to make sure that you are taking the right precautions. And if your family has anybody who is in the higher risk category, you need to take additional precautions so that you're not transferring. And because of asymptomatic transmission, you might be having the virus, but not be showing any symptoms. So it's good to maintain safe distance, practice like more like cleaning within your settings, and also be like wear the mask.
Okay. Another question, please further explain why a lower temperature than normal could be a symptom of COVID.
So when you think about like lower temperature, right? For example, like if somebody who's an older adult, so if the person's temperature is they might have like a single reading higher than 100 degrees, or if they have multiple readings above 99 degrees, or just a rise in temperature greater than 2 degrees, could be a symptom of COVID. But that sometimes that might be missed, right? Like if their normal body temperature, if they're 2 degrees higher than what is their normal body temperature, that could also indicate a sign. But sometimes that is missed because we think that, everything is above 100 degrees is what constitutes a fever, but sometimes we miss not knowing that some older adults' core body temperature might be lower than younger adults.
So what you're saying is that a lower temperature than you normally have is not a symptom?
A lower temperature than like a higher, so if your core body temperature is usually, I would say 98, right? And then if it's like 2 degrees higher, or if they were like their core body temperature is 97, and if they had consistently like 99 degrees, it could mean that they might have, like it might be indicating a fever, but if you're somebody like a younger age group, that for that person, the core body temperature itself might be higher, right? Like at 98. And then if they're measuring a temperature of 100 degrees, then for them, that constitutes a fever. But for somebody who's an older adult, if the core body temperature was only 97, a consistent 99 might indicate a fever as well.
Sure, gotcha. And another one, what type of tests are being done at the Alliance Center right now?
The Alliance Center does PCR tests.
And which test was that?
The polymerase chain reaction, that is like it's the molecular test.
So that's the best.
That's the best test.
Yeah.
Yes.
Okay. And finally, how safe is it to shop for groceries?
Grocery shopping is like, for now, I would say like it is like you don't need to worry about like grocery shopping, but at the same time, you need to like wear mask. And then if you're like practice the hand washing and use your hand sanitizer after you're done picking up your groceries, right? Like, so the minute you're done picking your groceries, before you walk back to your car or take a public transport or anything, use the sanitizer, clean your hands once you come home, do not touch your face, right? And then mask. And then your mask will protect somebody and somebody else's mask will protect. And if you're unable to like socially distance, like make sure that you can distance from somebody else. But if you're unable to do so, just come back home and practice all the hand hygiene and other necessary steps to take. So it is safe. Like I would not say that going to a grocery store, you might get it. But because community spread is happening, the one thing that we need to remember is for us to be safe and practice take all the necessary measures. So you are not, like, even if you're exposed, you're not like touching your face or wiping your nose right after you're picking something, right? And then that's the way that it gets into your system. So if you just have to like be a little extra cautious, but not be
Sure.
like paranoid about shopping.
Right. Oh, great. Sri, we're going to be getting on to our next speaker, but I want to thank you so much for everything that you do for our community. And thanks for joining us today. And now we're going to listen to Jennifer Fischer from the Dane County Department of Human Services. Jennifer?
And there we go. Perfect. All right, and can I just verify that I am showing my screen?
You are.
Perfect, okay. So my name is Jennifer Fischer. I'm the manager of the Aging and Disability Resource Center. And I am here today to talk to you about COVID-19, the emotional toils of COVID-19, the especially hard impact on caregivers, and the importance of connecting with community resources. So there we go. Who would have ever imagined 2020 being the year of a pandemic? We knew 2020 would be the year of the presidential election. That was a predictable 2020 event. COVID-19, however, was not. This disease has had such a great impact on everyone's lives. The Triad Conference is virtually only this year. People are working from home. People are encouraged to stay home. We have to wear masks. Weddings were postponed. Nursing homes and assisted living did not allow visitors for a period of time. And we're asked to not gather in large groups. The state was under a safer at home order. During that safer at home order, it was hard to believe that we would still be in the pandemic now. Today, it's almost November, and there's no way to predict when life is going to be back to normal. The number of people testing for COVID-19 is higher than ever, along with the number of hospitalizations. And we're on the national news because Wisconsin's considered a hot spot. Our lives are impacted every day because of COVID-19. So you ask yourself, how do we manage? When will this end? Mental health is an important part of overall health and well-being, and this pandemic has affected everyone's mental health. Have you or someone else ever expressed feeling anxious during this pandemic? Anxiety is a feeling of worry, nervousness, or uneasiness, typically about an imminent event or an uncertain outcome. Anxiety can interfere with our daily life. There are many signs and symptoms of anxiety that we should be aware of. Excess worry, fear, a general feeling of weakness, fatigue, feeling restless, not being able to concentrate on things, having a sense of doom, sweating, trembling, trouble sleeping, and stomach issues. Studies have reported that during this pandemic, up to 1/3 of people report feeling anxious and depressed. It is important to do things to help manage your anxiety and your stress level. The Center for Disease Control recommends doing such things as limiting the amount of news that you watch, read, and listen to. Practicing calming techniques such as meditation. Meditation can give you a sense of calm, peace, and balance that can benefit both your mental well-being and your overall health. It can help you clear away the information overload that builds up every day. It's also important to get up and move your body. Moving your body is important. It can help to calm the tension in your body. Take a walk, stretch, do chair exercises, even taking the long way across your house to get to another room. Just keep yourself moving. Connecting with others in any way that's possible. Calling a family member or friend, speaking to your neighbors, joining a pen pal group, participating in trainings and education like you are today are all ways to help us stay connected with other people. Find activities that bring you joy. What makes you happy? Make sure that you're doing things that make you happy. Reading, gardening, listening to music, watching birds. It's important that we incorporate that in our everyday lives. The other thing that helps us is getting things done. Cleaning a closet that's been there for a while that needs cleaning, organizing a bookshelf, organizing a drawer, just the feeling of getting things accomplished really helps your anxiety level. Finding ways to laugh. What makes you laugh? Is it a joke, a television show, a funny book? Humor is a wonderful coping mechanism in a time of crisis. Your worries may not go away on their own, and they may get worse over time. And if they do, you should make sure that you seek medical help from your doctor or mental health provider. It's easier to treat anxiety if you get help early rather than wait too long. Human beings are social creatures. Our connection with others enable us to survive and thrive. COVID-19 has affected and impacted this connection with others. We're encouraged to stay home and social distance. Places that we used to go for socialization may no longer be open right now. COVID has brought about social isolation to many of us. Social isolation is defined as having little or no contact with other people. People can be socially isolated and may or may not feel lonely. Loneliness, that feeling of bleakness and desolation, sadness, because you may feel like you have no company. Loneliness is not necessarily about being alone. It's about that perception of being alone. So you may be in a room full of people and you could still feel lonely. AARP reports that social isolation and loneliness are serious health conditions and have calculated that as the equivalent of smoking 15 cigarettes a day. There are many symptoms of loneliness. Some of them are common, like decrease of energy or your appetite, being unable to focus or feeling like you're in the fog, sleep issues. So insomnia where you can't fall asleep, waking up during your sleep, other sleep issues, feeling of self-doubt, anxious, body aches and pains, substance misuse, so drinking more than normal, drinking every day where you never used to drink every day, taking medications more often, doing some self-medicating. Also, craving physical warmth, such as hot drinks, baths, cozy blankets, are all signs of potential loneliness. Now we're talking about being a caregiver. Being a caregiver is not an easy task, whether you are caring for a family member or you're a professional caregiver. Caregiving can take a toll on you. COVID-19 has made being a caregiver even harder. Family caregivers from a University of Pittsburgh study report that the pandemic has increased their caregiving responsibilities and that providing more care is being emotionally, physically, and financially difficult on them. And this is largely due to the interrupted access to care, with things being closed down. And it results in lifestyle adjustments that have led to increased worry, fear, depression, and anxiety. Now more than ever, caregivers need to build circles of support. Building circles of support are finding those people who can help you on your caregiving journey. So who are those people, and identifying who they are, asking them to be part of your circle of support, and making a plan, and talking to people and sharing that plan is extremely important during this time. So there are some tools that we have that can help you build your circle of support, and that is important to have during caregiving. One of those are, well, two of these are our File of Life and our First Responders tool. So our File of Life is a tool that lists who your doctor is, who your emergency contacts are, your medication, your medical issues, your allergies, if you have your advanced directives done, and then this is kept on your refrigerator. Along with that File of Life, and this is what it looks like and where you can find the File of Life. You can also call the ADRC at 240-7400, and we will mail one to you. If you have a person in your household who is living with dementia, We also have a Purple Angel sticker that you can stick on that file of life when you put it on your refrigerator to help notify people that you have a person living with dementia in your household. We'd also ask you to put that sticker on your door jamb so that first responders can see this when you come in. And also along with this, we have our first responder tool, which is specifically for people with dementia. And this first responder tool, once again, collects general information, but it also asks things like, can the person that you care for be left alone? What comforts them or soothes them? What upsets them? And what strategies work for them? Like, do they like to go for a walk? Do they like to go for a car ride? Do they have any sensory aids or a cane or a walker that they need? These are all really important because if something happens to you and the first responders come to your home and you cannot say that you provide care for a loved one, when they have these forms there, then they know. So you can call the ADRC to get any of these forms and we will send them to you in the mail. But as caregivers, it's really important that you take care of yourself. It's often something that caregivers forget to do. They put themselves last. But on a positive note, resources and supports have changed along with the pandemic and are available for you. Support groups have moved online, and there's also call-in support groups for those who do not have a computer to access them. We ask that people make time to call family and friends and connect with them to help take care of themselves. You need to combat that feeling of social isolation and loneliness. If you are one of those people feeling loneliness, there are many, many groups right now who are making phone calls to people to check in with them, be it daily, once a week. There are many, many different programs that the ADRC can talk to you about. The ADRC also during this time has continued to offer our brain and body fitness class, where we can pair a person with early stage dementia with a volunteer and they can make connections. Our Alzheimer's Association and the Alzheimer and Dementia Alliance have moved their memory cafes online so people can still participate in those activities. It's also important to remember to take care of yourself. Get outdoors, change your scenery as much as you can, doing it safely. And it's also really important, even during this time when things are not running as normal as they usually do, to keep your routine. Keeping a routine helps keep balance in your life so that you're not just getting off of what a normal day is. So keeping your routine is super important. Take time to exercise. And last but not least, make sure that you ask for help. Thank you. And then if you are a caregiver, we encourage you during this time to have a backup plan. So what would happen if you or your loved one contracts COVID-19? Have you spoken to family or friends about what your backup plan is? Do you know what types of resources are available in the community to help? What are the in-home agencies that would come in if you contracted COVID-19 and couldn't care for your loved one? Is there an assisted living that would admit someone who is COVID positive if they need to go there for a period of time? Or is there still respite available? If you had a 14-day quarantine, how would you get your groceries, your medications? These are all things that the ADRC could help you connect with and learn about those community resources so that you know, and making that plan in advance so you know what your plan is. So COVID-19 has been a long journey and it continues. And now we are at the point where we are feeling burnout and fatigue. We're tired, but we need to stay the course. So I'm asking all of you to make a commitment to our behavior changes. Like we wear a seatbelt every day, our habits start with making a decision. So we want to keep yourself and your loved ones safe by doing the right things. Washing your hands, maintaining social distance, wearing a mask in public. We're asking you that even though this has seemed long, to please continue to do those things. Stay flexible as recommendations change. We have the mask order now to adopt those changes. And continue to practice precautions. I know that we're tired, but we need to continue to do those things. And keeping supplies handy, like keeping hand sanitizer around, keeping multiple masks around, help to make that easier. The other thing that helps combat burnout is to make the pandemic personal to you. Think of someone that you know who has contracted COVID-19 and their struggle with the virus, or read a story about someone who has struggled with the virus. But keeping those personal thoughts about how it has affected someone helps you stay the course and not get caught in that burnout. And last but not least, setting time aside to recharge yourself. Taking care of you, doing meditation is super important. So some additional resources I want to talk to you about is that the Institute on Aging has a friendship line for 24-hour crisis line to talk to people age 60 and over, and I've included that link. I've also included the link to the National Suicide Prevention Hotline, or if you prefer to text, you can text to the Hope Line. And I've also included the link to Resilient Wisconsin, which has many mental health resources related to COVID-19. Sorry. I skipped this slide. So you can call the Aging and Disability Resource Center where I currently work. We answer our phones 7:45 to 4:30 Monday through Friday, and we can provide information on community resources. We are co-located with the Area Agency on Aging in Dane County, who has made a guide on social isolation, and I've included the link for that social isolation resource guide. If you're interested in getting involved with meditation, the Healthy Minds Innovation Lab was started by a neuroscientist, Dr. Richard Davidson. It's a nonprofit affiliated with the Center of Healthy Minds at the University of Wisconsin, and they actually offer a free app for your cell phone or your smartphone, and they have resources online if you want to learn more about meditation and staying centered in yourself to help reduce some of that stress and anxiety. And then one thing, people used to go to the Monona Terrace to do meditation, and they themselves have moved to a free online Zoom class. So I have included the link to the free Zoom class so you can participate with other people at the Monona Terrace doing meditation. So thank you for attending today. I am Jennifer Fischer from the ADRC.
Jennifer, we have a few questions for you.
Okay.
The first one is, I've heard that social media can increase anxiety. What are your thoughts about that?
I think that if you allow it to take a lot of your time, it can increase anxiety. So like one of my slides said, it's important to limit that. If you're spending all of your time on social media reading about this, that's going to increase your anxiety and your stress load. So limiting your time on social media about the pandemic is a really good thing to do to help take care of your mental health.
Okay, and the other question is the first responder tool available to download? And I think that is probably referring to the File of Life.
Yep. And I, in my slideshow, both of them, the first responder tool and the File of Life, are both free and available to download. The link is included in the slides. And if you don't want to download one, you can always call the ADRC and we will send one in the mail to you free of charge.
Okay, great. Well, Jennifer.
Yep.
I'm sorry. No, go ahead, please.
Oh, I was just going to say, if we mail you a first responder tool, it will be on purple paper. Purple is the color for Alzheimer's and dementia. So just making it a little easier to see.
Okay. Thank you, Jennifer. That's all the questions we have for now. And I am just so grateful that you were able to take time today to talk to us about this. Thanks so much for what you do. And now our final speaker is going to be Doug Judges, who's going to talk about the financial aspects of COVID.
Thank you, Jim. Those are tough acts to follow. Great information, great speakers. Thanks, Jim. Thanks, RSVP and Triad and everybody attending today. I'm going to hopefully share my screen here and let me know when you see it.
We see it.
It is up there?
Yes.
Okay, great. So I'm going to just spend a few minutes on prepared remarks and leave most of my time up open for questions. That tends to be the best way to talk to people about what's really on their minds. If there are few or no questions, we won't have trouble filling the time because I could probably talk about this for days. My name is Doug Judges. I'm our wealth advisors in Monona. I've been an advisor for 20 years, been in the industry for 30 years. I've studied the markets and economies for going back to the beginning of investing. Well, not really, but certainly for a long time now. Have seen all kinds of ups and downs in the markets. Have seen the effects on investors and people who are participating in retirement plans. This year was unusual in terms of COVID-19. That was an unusual shock to the system, but it was not unusual in terms of how the market and the economy reacted. We look at this page that I have up here. January and February is when we first started getting word of COVID-19, and really didn't affect the markets much. The markets were at all-time highs well into late February. But then when it really started getting serious in this country, the first things that came out were, well, we had to shut down travel from China and other parts of the world, and that started disrupting supply lines. So in the beginning of, or starting late in the third week of February, the markets did start to decline pretty precipitously. That was more because we were worried about supplies coming from China and other parts of the world and how that would affect the economy. Then in early March, that's when we started getting more and more infections here in the US. And that was very concerning for the markets as well, as we had to start shutting down businesses, and particularly things like travel and leisure, entertainment, restaurants. When that started happening, the markets kind of snowballed on their way down again until about March 23rd of this year. The markets kind of bottomed out. Yes, the economy, and let's separate the economy from the markets just for a moment. It's one thing to talk about what's going on in the economy, and another thing to talk about what's going on in the stock market. Stock markets usually are trying to look very forward. So they're trying to anticipate what's going to happen in the next 3 months, 6 months, 1 year, 5 years from now. A lot of times when there's a shock to the stock market, it'll recover faster than the economy. And that's kind of what we saw starting in late March. Well, in late March, news came out that the government was providing a stimulus package, the CARES package. You may have heard of that. A lot of us got $1,200 checks, or $2,400 if you were a married couple. The Federal Reserve lowered interest rates. And what happened was the market took notice of that, and we started, kind of somewhat surprisingly, started a recovery in the financial markets, and it really hasn't stopped. Here we are today on October 26th, so just a few days ago, and the stock market, as measured by the S&P 500, is close to its all-time highs again. So with stimulus, with lower interest rates, also there were several sectors of the economy doing very, very well. Make no mistake about it, COVID-19 is a very concerning thing, certainly from a health perspective and an economic and market perspective as well. But the markets did take notice that while there were certain industries and sectors of the economy that are very much struggling and will probably struggle for quite some time, there are other parts of the other industries and parts of the economy that actually were doing very, very well. Think of things like online retail, delivery services, Amazon, tech, retail, all those were actually doing very, very well. I hadn't heard of Zoom until somewhere in mid-March when people started using Zoom much more often. So things like that, things like what we're using now, they're actually doing well. So the markets have taken notice of that and have recovered here, at least in the short run, quite nicely. Well, so we talk about the stock market and we focus on the stock market because that affects retirement plans, right? Many of you out there, maybe most of you out there, if you are not already retired, you are working and you're accumulating, you're trying to save up money for your retirement. So you're participating in things like 401ks or 403bs, IRA accounts, traditional pension plans, things like that. Well, the stock market, of course, affects all of that because many of you have invested part of your portfolio in stocks. And back in the spring, if you looked at your statements back then, you saw your balances go down quite a bit if you're participating in one of those types of accounts. That has all kinds of effects, from doesn't bother me at all to what am I going to do if I lose all of this? Okay, and it becomes very, very concerning and psychologically a difficult time for people to deal with. And then as the summer went on and going into the fall here, yes, COVID-19 is actually, the numbers have certainly gone up here, especially the past couple of months. But you're seeing your statement balances get more back to where they were. And that makes us all feel better. Doesn't mean we're out of the woods just yet, but it does have a more positive effect on it. So finally, just with my prepared remarks, what do you do in situations like this? Well, a lot of times you basically just hold. Markets over time, they do go down. Many of you maybe remember 2008 and 2009, the financial crisis. Markets went down similarly to this. It was a more prolonged period of time that it was down, but it went down. And if you just held on, you came back and you recovered. Same thing happened back in 2001 to 2003, 1991 to 1992. Various times it's just a part of the financial and economic world for markets to do these things periodically. And as advisors, what we try to do is we're not going to call necessarily the bottom of a market, but as the market is declining, we will a lot of times try to, if we can, if there's opportunity, buy some investments as prices are going down, because that doesn't mean that your investments are bad. It just means they're going through a period of price reductions because of what's going on in the markets currently. So if you can take advantage of buying investments while they're at bargain prices, that's actually good. And then when the markets do recover, your portfolio will recover faster. So that's one strategy. There are many more things that can be done, but part of it is just having this mental ability to just say, you know what, this is going to happen once in a while. Even if you're in retirement, you see your account balances go down, but you don't actually lose money unless you sell those investments while they're down. So we try to recommend against it. I guess that's it for now for prepared remarks. Jim, are there any questions that I can address?
Are there any sectors for a person who is picking stocks that are good investments right now?
Well, that is a common question. Sectors that are doing well right now don't necessarily mean that they're going to do well in the future. So we tend not to call or make what's called sector bets. I can tell you which sectors are doing well, but that doesn't necessarily mean it's the wise thing to invest in.
Sure.
So for example, technology is fantastic. It's doing great. It likely will continue, but it's very hard to tell. And it's very hard to figure out which tech stock to actually buy. If you get Apple or Microsoft, things like that, they're at a high point. That doesn't mean that they're going to continue to go up from here. If there's a disruptor that comes in, or if there's some other thing, be it COVID-19 or a financial crisis or whatever, that can disrupt them too. Would I invest in something like travel and leisure? Because, it's travel and leisure is down right now, and down terribly, and really a struggle, and it's upsetting and very, very unfortunate. But at some point, travel and leisure is going to come back. And so it may be wise, you got to hold on for a while, but it may be wise to buy, a travel and leisure stock. I stick with the big tried and true names that have been around for sometimes. Maybe stay away from cruise ships, because I have a feeling that it's going to be years before they, it's too bad, but it may be years before they really recover. But travel and entertainment industry, probably, once we get past this, could have a nice boost.
Right. Another question, Doug. How concerned are you that even though the COVID epidemic continues and seems to be getting worse, the stock market continues to go up? Are we in a bubble created by the Fed and government stimulus?
That is a fantastic question. Somebody who's really paying attention to things. We kind of have a joke at our firm, a running joke at our firm, because people ask us all the time, what's the stock market going to end up at the end of the year? And we say it's either going to be up, or it's going to be down, or it's going to be about where it's at. It's so hard to predict whether or not we are in a bubble. I'll switch gears very, very quickly here. And just talk about presidential elections, because we got one next week, right? Lots of people are very, very concerned about what's going to happen. But so some people will think that if Trump gets reelected, we're just going to fall off the table, and especially now that we're at a high point. Some people say the same things about Joe Biden, okay? If you look back at all of the previous presidential elections, you may have some very, very short-term fluctuations in the market, but the presidential election has never had a long-term effect on where the markets are going. In fact, the markets usually do well no matter what party is elected. There's some short-term ups and downs, but it typically does just fine over the long run. Are we in a bubble right now? Well, I thought back in May and June, when we started recovering, that it just doesn't seem possible that the markets should be doing as well as it is right now. So this is a long answer to say I don't know, and that's maybe not a good answer. But I also I know enough and have been experienced enough not to call a bubble. Are there other issues with the Federal Reserve keeping interest rates as low as they are? Yes, for the future. There could be some significant impacts 2 years, 5 years, 10 years from now, because we're keeping interest rates low now. That's a long conversation, so I'll try to stop myself here.
Oh, okay, Doug. Well, that is it for our questions. Oh, it looks like another one has popped up. Just a second. Okay, no, I guess that's the end of our questions. So, Doug, if you don't have anything else to add, I'd like to thank you so much for taking part and making a complex topic interesting and understandable. That's a real talent that you've got. So thanks so much for appearing. And I would like to thank everybody for joining us this last month. This is the final segment of our Triad conference for this year. It was a great experiment this year because we, for the first time, had to go virtual. And we just thank the Department of Justice, the Wisconsin DOJ, and Attorney General Josh Call, and several of his key employees for making this possible and for handling all of the technical aspects of this. We certainly couldn't have done it without them. So thanks so much